Hello, everybody. Thank you again for joining me. All right. My name is Dr. Princess Fumi Hancock. People know me as your Global Vision Midwife. Others call me your trauma care maestro. And of course, I'm a best-selling author. Thank you so much for joining me. And of course, the CEO of Pulo Psychiatric Group of clinics in Arizona. So this morning, I wanted to chat with you about anxiety disorders. Um, Anxiety disorders, sometimes people come to me, they're not quite sure if what they have is anxiety. They're not sure. And they're not even sure. Some people say, well, I don't even know if anxiety exists. Well, let me be the first one to debunk it. Anxiety disorders are real. They are real. They're not only real, they are serious um, conditions. All right. So just as real and serious as physical disorders such as heart disease, right, or diabetes. There have been people that have come who have panic disorders or anxiety and they feel like, oh my God, I'm about to pass out. And some of them even think that they're having a heart attack. That's how bad and how serious it can get. So anxiety disorders are the most common and pervasive mental disorders in the United States. And yes, in Africa, even though we try to, pretend like we don't have anxiety or depression, but it does exist there too. All right. It's a normal part of life to experience occasional anxiety. There are some, healthy ones, right? So let me say that again. It's a normal part of life to experience occasional, that's the underscore one, occasional anxiety. But you may experience anxiety that is persistent. In other words, anxiety that just refuses to leave you alone, right? It's uncontrollable and overwhelming. If it's an excessive, irrational threat of everyday situation, then this can be disabling, where you think about everything in life, you're overwhelmed. Then you start panicking. Then you start having anxiety. You want to get out of your home. Okay, anxiety creeps in. All those are excessive. The excessive anxiety can make you avoid work. It can make you avoid school, right? Family get-togethers. You don't want to be a part of it because you're anxious just thinking about it, and other social situations that might trigger or worsen your symptoms. With treatment, many people with anxiety disorders can manage their feelings. So let's talk a little bit about symptoms that are prevalent in those who do suffer from anxiety, because after all, how do you seek help for something that you don't even know you have? Right? So the main symptom of anxiety disorders, excessive fear or worry, it's one of it. Anxiety disorders can also make it hard to breathe, right? Sleep, still, right? You can sit still and even have difficulty concentrating. Your specific symptom depends on the type of anxiety disorders that you have. Well, let's talk a little bit about the common symptoms that are out there. Panic, right? Panic, fear, being uneasy about everything, and I mean everything, right? The feelings of panic or doom, like an impending doom, like, ooh, something bad is about to happen, even though there's no rationale for that thought, right? Or, ooh, something dangerous is about to happen, right? Sleep problems. Some people cannot sleep well. Some people, have difficulty falling asleep or staying asleep, not being able to stay calm and still, as I mentioned before, right? Some people will even go as far as having cold, sweaty, or numb or tingling hands or feet. Shortness of breath is one of it. Breathing faster, right, and more quickly than normal, kind of like what you call hyperventilating. That's right. Heart palpitation is one of it. Dry mouth can also be part of it too, right? Nausea, you feel so anxious that you want to throw up, but you just can't throw up, right? tense muscles, your muscles all over, your shoulder muscles, everything is just tense. And some we even will experience dizziness, thinking about a problem over and over and over and over again and unable to stop. We often call that rumination. That's part of it. Inability to concentrate, as I mentioned before. Intense or obsessively avoiding feared objects or places. So what will be the risk factors? I love to ask questions. What will be the risk factors for anxiety disorder? Some things also make you more likely to develop an anxiety disorder, right? Those are your risk factors, those things that make you more likely to develop it. These are called risk factors. Some risk factors you cannot change, and others you can, right? So risk factors for anxiety disorder include history of mental health disorder, right? Having another mental health disorder like depression often raises your risk for anxiety disorder. Trauma, that's a big one. Trauma. Living through a traumatic event increases the risk of post-traumatic stress syndrome, PTSD, which can cause panic attacks. Now, some people often, when they hear PTSD, they think you have to be sexually molested or something like that. It could very well be maybe you ran into somebody on the streets and you fell and you broke your knee, or you had a bad accident, or sexual assault too is part of it, physical assault, emotional assault, all kinds of trauma. Those things that just shift your world the opposite way. Those are traumatic events, right? Negative life events would often increase your chances of getting anxiety disorder. Stressful or negative life events like losing a parent in early childhood that would definitely increase your risk for anxiety disorder. Now, severe illness or chronic health condition will often do that too. What do I mean by that? Constant worry about your health or the health of a loved one, or caring for someone who is sick can often cause you to feel overwhelmed and anxious. I often say to caregivers, you've got to take care of yourself. A lot of times our caregivers, they get so sucked up into taking care of that person that when that person passes, then they feel lost, they feel alone, and they start going through their own mental health issues too. So another one is substance abuse. The use of alcohol and illegal drugs makes you more likely to get anxiety. In this time and season of pandemic, we see an increased use of alcohol and substance abuse. So we have to be very careful with that, because that is a risk for having anxiety disorder. Some people can also use substances to hide or erase. They say they use it to ease the anxiety. I've often had people come to my practice and tell me that they use marijuana to ease the anxiety. But then when I rate the anxiety, I say, well, on a scale of 1 to 10, 10 being really terrible, tell me what your anxiety is. Then they tell me 20 over 10. So, okay. So you've been using marijuana to ease your anxiety, and you're in front of me today telling me that your anxiety is 20 to 10, 20 over 10. I need not tell you further. All right. So being shy as a child, shyness and withdrawal from unfamiliar people and places during childhood is linked to social anxiety in teens and in adults. Low self-esteem is another one. Having negative perception about yourself, right, may lead to social anxiety disorder. Let's talk about treatment, right? There are many treatment components to reduce and manage symptoms of anxiety disorder. Usually people with anxiety disorder will take medicine, right, medication, and then they also go to counseling. Some people prefer to start with psychotherapy, and they're in therapy for 2 or 3 years, feeling a little better, but not quite there. And this is when they see somebody like me, a psychiatric provider, a psychiatric board certified psychiatric mental health doctor of nurse practice, to kind of help them maneuver their way, because many people are always afraid of medications, maybe because of their past experiences with it. But it's important that you go to someone that you can trust with that, someone that can work with you as a partner, not tell you what to do, but work with you as a partner. So number one, psychotherapy is great. I often tell people that come to my practice that not only am I just going to, tell you, okay, this medication will work for it, but it's important that you also seek therapy. I do some psychotherapy with mine, but mine is more focused on the medical psychotherapy, where I do send people out to do like a one-on-one serious in-depth CBT based psychotherapy, or even what is called EMDR, which I can talk about some other time. All right. So psychotherapy is a type of counseling that helps you learn how your emotions affect your behavior, right? It's sometimes called talk therapy, but psychotherapy can also be, as I said before, you can talk about CBT, EMDR, where EMDR is a tough one where you really go in depth into your, childhood. Very painful, but very effective too. So a trained mental health specialist listens and talks to you about your thoughts, about your emotions, your feelings, and suggests ways to understand and manage them and your anxiety disorder. So you've got to take care of your mental health. This is very important to your physical health, right? You cannot separate them. I do not understand it when people say they can separate this. You cannot separate them because they both feed into each other. Take, for instance, somebody that is suffering from diabetes, and then he goes to his doctor, who keeps saying, the physician keeps saying, well, you're not using your medication. You're not. Well, he's probably frustrated and he's depressed. Perhaps if you dealt with his depression, then he will be obligated. He will feel better enough to say, okay, I got a bigger why to be compliant with my diabetic medication. So all of these come together. It's important that you talk to someone like me, right? A board-certified psychiatric mental health doctor of nurse practice, right, in your area. Or, better yet, we live in an age now where, telepsychiatry is really big. So if you have any questions, if you want to know more about this, please check me out at pobpsychiatry, pobpsychiatry.com. You can also look at my personal email website, which is Dr. Fumi Psych DNP. DRFUMI, or better yet, just Google Dr. Princess Fumi, FUMI Hancock, and boo, you're going to see me there. Until next time, be inspired, be motivated, be of sentimental value. Understand that you're the hero in your life story. Do not allow anybody to rewrite your story. You are great. You are awesome just the way you are. Until next time, it's bye for now.